Dr. Steve Gorman from the Gorman Center for Fine Dentistry. Thought I would talk today a little bit about temporomandibular joint and temporomandibular disorders. We get a lot of questions about those, and we see a fair number of patients who have different manifestations. I thought I would answer some questions, and some have been submitted to me. The first one is, what are the definitions of TMJ and TMD, and how are they different? And really, TMJ just means temporomandibular joint. That's the name of the joint, our jaw joints, and we all have two of those. TMD is really the term that we're looking for. And when people say, I've been told I have TMJ or I have TMJ, what they're really referring to is they have TMD, temporomandibular dysfunction of some sort. So there are a lot of things that fall into the category of temporomandibular dysfunction. A lot of them are related to bites and bite issues. And a lot of the problems that people have with their jaw joints are because their bites are off, and then their body is responding to those bites by trying to get rid of bite interferences and things, and it causes a lot of muscle activity in the opening and closing muscles of your jaws, and they can get fatigued. And so a lot of people who have bite issues end up with muscle soreness, muscle fatigue, and muscle headaches in the temporal area. And over a long period of time, the tenseness in those muscles can start to pull on the components of the jaw joints themselves, ligaments. There's a disc that rides between the top of the jaw bone and the skull that it articulates with. That articular disc, it's made out of a cartilage, and it is not innervated, but the tissues all around it are innervated. And sometimes that can get out of position based on what the muscles are doing. And so anywhere from slight headaches, slight muscle soreness, pain in the ear, to major discomfort, major inability to open and close, all of those things fall under the category of temporomandibular dysfunction.